Multiple sclerosis is a chronic autoimmune disease affecting the central nervous system. In this process, it damages the myelin, which is the protective covering of nerves. Since this is an autoimmune disease, the immune system attacks the healthy myelin and damages it, which is called demyelination. And this is a picture of a normal nerve cell versus a nerve cell with sclerosis. And you can see how the muscle is not able to contract because of the damaged myelin. As this disease progresses, the outer layer of the brain shrinks, which can lead to continual decreased neurological function, and this can also lead to end-stage multiple sclerosis. And this is kind of a picture of how the brain can atrophy throughout the process of this disease. Some signs and symptoms of multiple sclerosis is vertigo, dizziness, double vision, weakness, fatigue, memory trouble, decreased coordination, and Le Hermit sign, which is a brief electric shock sensation that runs down the spine into the arms and legs when the neck is flexed down. So here's a picture of that shock whenever the neck is flexed down. Some preventions and risk of multiple sclerosis. There's no definitive reason of why people get this, since it is autoimmune, but it could possibly be genetic or environmental factors. Females are much more susceptible to getting this, and then inadequate vitamin D levels can cause maybe a higher risk of multiple sclerosis, because vitamin D is a key regulator of the immune responses, and it's also a neuroprotective property. And then intermittent fasting can also decrease this risk of multiple sclerosis. Some treatment and care to diagnose MS. There's no specific treatment or cause or diagnosis test that we can run, but we can do a spinal tap, which can detect inflammation and rule out the other diseases. A spinal tap will also let us see the oligoclonal bands, which is just a inflammatory thing that they can look at. We can also do an MRI to see the lesions, if there are any lesions, a medical history and a physical exam to see their signs and symptoms of what they could be experiencing. Some medications that you can take for multiple sclerosis is immunosuppressants and antidepressants. Antidepressants to help with the mood changes that you'll experience throughout this disease. You can also take steroids, which can reduce the inflammation and suppressing the immune system. Steroids like corticosteroids or glucose steroids can slow damage to the myelin sheath. And then there are 4 different types of MS. The only one I put on here is a relapsing remitting, because this is the most common. And this kind of gives a person new signs and symptoms and relapses them, but then it'll mainly improve. The other 3 main types are secondary progressive, primary progressive, and progressive relapsing. Almost 1 million adults in the United States are diagnosed with MS, and they're usually diagnosed within the ages of 20 to 40 years old. And that is it for my slideshow. Thank you.